My name is Vince Donovan from Solutions Training. I'm delighted to have been asked to deliver a presentation on the subject of lone worker personal safety during COVID-19 on behalf of Security 2020. By way of introduction, Safety Solutions have been delivering training for nearly 20 years, and we work with a variety of clients throughout the UK. We work with local authorities, housing associations, and national charitable organisations that include the Crisis, Homeless Charity, Big Issue, and many, many more. During this presentation, I would like to cover the particular responsibilities for employers under the Health and Safety at Work Act and how they best manage the safety of their staff, particularly during COVID-19. So how does the Health and Safety Executive describe a lone worker? Well, a lone worker is somebody that obviously works alone without any direct or close supervision. 4 key areas are identified under the policy. Employees who work alone at a fixed base. Some examples. Employees who work separately from other people on the same premises or outside normal working hours. Thirdly, employees who work away from a fixed base, such as health, medical and social care workers visiting people's homes. And I guess the 4th area, which has become certainly more of an issue during COVID-19, is for those employees who are now working at home. Organisations have a duty to not only identify risks, but to manage those risks to protect their staff when their staff go about their work. There are obviously a variety of risks. Medical situations, the risk for some staff being bitten by dogs, risks with regard to people who open or secure premises at the end of the working day, the general risk of trips, slips and falls in every working environment, the risks of neck strain, back strain as a result of poor posture or certain working conditions. Stress is a big factor, particularly during COVID-19. And unfortunately, the risk that exists for all employers when they have face-to-face contact with their service users, the risk with regard to violence and aggression. In addition to the previous risks, there is a new risk, unfortunately, one of COVID-19, and the need for organisations to do their utmost to protect their staff when they go about their work. So what does the organisation have to do? Okay, so the key areas, they've got to provide instruction and training and supervision. Organisations have to provide protective equipment and communication devices for those staff, or to have a communication strategy with those staff who are working alone. And obviously to introduce safe working practices. Once those have been defined in their organisational policies and procedures, there's also a need for those to be checked and verified and to be reviewed to see if things need to be changed or new measures implemented. Organisations need to be up to date with relevant guidelines from the government regarding social distancing. Be aware of the use of personal protective equipment in certain environments and general hygiene regarding keeping the hands clean. And continuing that with their cleaning requirements depending on the working activities taking place in that working environment. The use of masks in certain situations, full visors or face masks, sometimes a consideration when working with children to have visible face masks can certainly assist in that communication. There's also a need for staff to be aware of how they safely dispose of personal protective equipment. So are staff prepared? Are they trained? Are they able to handle difficult or challenging situations when their service users cross the line? Staff can experience difficulties at reception areas, in interview room situations, or just generally challenging members of the public as a result of their social distancing requirements. Organisations have a responsibility for those staff who travel, sometimes quite long distances, to visit their clients. Some of those clients may be in quite rural areas, very isolated areas. Staff using their own cars can encounter breakdown situations, and can they cope? What does a member of staff do in emergency situations? And it's important that organisations have a means of communication so they can contact them, their personal phone numbers in addition to their work telephone numbers, their home telephone numbers? Do organisations know what concerns or risks, what medical issues a member of staff may have? As an organisation, do we know what car registration number, make or model the member of staff is using? Are they encouraged then to keep a calendar diary of their working and visiting activities during that particular day? Do we have a lone working buddying policy system where staff ring to say they're going in or they've just left a particular meeting and they're on their way to visit somebody new? Or do we use a monitored communication device? So when staff arrive at certain locations and they make their way, are they safe? Do they know to avoid certain situations? What to say in a difficult set of circumstances that suddenly arise? Are staff fully aware of their obligations when visiting somebody in terms of should they be going there on their own or should they be accompanied? Is this a visit purely for a male or a female member of staff? Are there dangerous dogs to be concerned about? This is the type of information that is imperative for organisations to pass on and make available to our staff. And the actual visit itself, and visiting a tenant or a service user in their home, introducing themselves in view of COVID-19 and thinking of the safety measures that need to be included when visiting that address. How do staff react? What do they do when they meet the tenant or the resident who is inappropriately dressed? How do they deal with dangerous dogs that may be present or active on the premises? How do they respond? What's it like for a member of staff who gets locked in a property and just purely out of habit, or is there some other reason why the actual service users lock the door? Sometimes the conditions of the properties that staff may encounter. Hoarding, we know, is an increasing problem, and how staff manage their personal safety in those environments. Sexual advances, being in difficult situations, dealing suddenly with an escalating situation, domestic violence present when a member of staff is visiting that particular person. When we consider the incidence of violence and aggression that employees can face, statistics in 2018 and 2019 remain pretty much common with many previous years. If we look specifically at the actual number of assaults and violent incidents, 739,000 incidents, comprising of 383,000 threats towards staff and 356,000 assaults. But with regard to those assaults, generally those results are related into various degrees of physical injury. The Health and Safety Executive's definition of work-related violence relates to any incident in which a member of staff, a person, is abused, threatened or assaulted in circumstances relating to their work. If we look at those three areas, how many staff report that they suffer some form of personal abuse when they go about their work? If they're threatened as a result of their working environment or the situation they find themselves in? If they're assaulted, whether it's a push, a grab, a poke in the shoulder, or something more serious? Or indeed if it's a sexual assault? Do our staff report these incidents? The question organisations need to ask is, do we fully appreciate the risks experienced by our staff? Can we say at the end of a particular year exactly how many of our staff suffered abuse, were threatened, were physically assaulted? What were the categories of staff who were more likely to suffer those incidents? What do the statistics tell us? Have we improved as a result of change to our safe practices on last year's incidents? Our employees have their own responsibilities to follow the policies and procedures that the organisation implements and to report certain incidents. And do our staff report? Do our staff report situations where they may have been abused, threatened or assaulted in circumstances related to their work? Are staff aware of our report processes? Do they know where to access online our incident reporting forms or the paperback versions within our organisations? Do staff receive feedback as a result of their reports? In my experience, there's a number of reasons why staff unfortunately fail to report incidents. Human errors and human factors come into play. Don't have the time to do it. What's the point? It is a waste of time. Nothing gets done anyway. Other common answers, it's just part of the job. It's just something I've had to put up with. the fear of reprisals in some situations. Generally, a lack of training. Staff don't always know what they need to report. It hasn't been explained to them. And sometimes a lack of training. Could they have handled this situation better? Did they in some way antagonise or provoke the situation? Safety Solutions provide a number of specialist training areas to address some of the concerns that have been expressed in this presentation. Conflict management, dealing with challenging or difficult individuals as a result of their work. Managing sometimes phone calls that can be challenging and difficult, abusive, threatening, or when on some occasions a service user threatens to self-harm. Lone worker personal safety for those members of staff who, as a result of their jobs, have to visit their service users. We also deliver specialist training in areas such as county lines, knife and gang crimes, and also preventing radicalisation and violent extremism. And certainly during COVID-19, many of our training subjects are now being delivered virtually online. If you would like to contact Safety Solutions for any of your specific training needs, you can find us on our website, or alternatively contact us on our office number, which is 029 20 65 7753. Thank you.